Hello, everyone. It's Rafael Gutierrez, Dr. Karate. Another video on the hip. Part of the reason I'm doing this is because information pretty much is always coming towards us. And I had a discussion online with two gentlemen who had really interesting ideas and concepts that I would have actually liked to bring up. One of them is Ole Korf. I hope I said that name right. Young gentleman, and John Titchen. And both of them made really good comments during the discussions. And sometimes one of the things that happens with a lot of discussions is that there is arguments, and I'm moving this just a little bit. There are arguments based on perception and new information. And people asking for, well, if that's true, then why not this? And there's a concept in academia called peer review, which is really important, and I wish we would actually adopt more of this in martial arts. Peer review, I'm not doing quite what I would do for peer review for this videos, but peer review works like this. Let's take the hip video. What I would do is I'd go out and read everything on the hip that I could, every peer-reviewed article, and I'd put it at the bottom of my research. I'd actually write it up, and there'd be a list of all the articles I read for hip. Now I do a lot of this. I actually do read a lot of articles, mostly because I find it interesting, and it does help in my career, which is teaching anatomy, physiology, kinesiology, clinical anatomy. And so I can use this with the work and video to make these videos and to further my martial arts. Now, I don't write these down on these because very few people would be interested in going and reading them. Most people may actually look at the list and say, yeah, well, you look at that, and then not necessarily pay attention to it anyways. And there's also a lot of times I've noticed that people will take what people say and claim credit for it on their own and won't necessarily know where to find the sources for it. And this way, if someone does it, I can ask, oh, well, what sources did he use? And if they don't have any, well, I know where they got their information. Won't call on it. Truth is, if someone wants to use my videos, they're more than welcome to use them. It's free. Why are you going to want to reinvent the wheel, right? But the thing is, with peer review, we actually will look at everything. It's not just that, well, I believe this or this is where it should be. We have to look at every aspect of it. Now, in our conversation, two articles really came up. There's a lot of other ones, like I said, that you could talk about with hip problems. But these two are important for two reasons. One is it actually gave us numbers, and it actually did look at martial arts. And two is it actually showed us mechanisms of how certain things occurred. And so that's actually one of the big things. The first one was actually the epidemiology study that came out in 2016, which I'll put a link in the description here. The other one was a correlation with the superior reticular artery inclusion, which I mentioned in the video, but we'll talk about that later. Now, I did talk about peer review, and I want to clear a lot of this stuff off, so let's get rid of this, and I'll mention that. Like I said, I'll mention this in the description, but I did mention peer review. Now, in the epidemiology study, they looked at a bunch of different sports, but three actually stuck out as the ones that had the most hip injuries. And they were soccer, baseball, and martial arts. They actually did specify Taekwondo in a couple areas, but then they also said it wasn't just Taekwondo, it was other stuff. And before you look at raw numbers, this is actually one thing you have to look at, is the normal population. Now, when I was trying to find the data of how many people in the world played baseball, soccer, and martial arts, it was hard for me to find specific numbers for worldwide. So instead, I was able to find the number of incidents of people who are active people who did these sports in the US. And what we found is 30% of active individuals play soccer. 15% play baseball, here in the US at least. And only about 5% are involved in martial arts. That's actually a big difference. So if we were talking about 156, I think it was 156 people who had hip injuries that were related to sports, we would actually expect 30% of those injuries to be in soccer if everything was random, 15% from baseball, and 5% from martial arts. With the 156 total, we found that 47 were from soccer, was predicted to be from soccer, 24 predicted from baseball, and 8 of these cases should have been martial arts. What we found instead is we found 44 were soccer, so a little less in soccer than we would have found from just a normal population. We found 24, I'm sorry, we found that we should have had 24, but we ended up having 36 from baseball, which is 50% higher. And we found 35 were from martial arts. Now that's actually a lot higher. That's 7 times higher from martial arts than should have been than is expected. Now we can say there is something about soccer, baseball, and martial arts that may attribute to hip injuries. But when we start seeing stuff like 35, when it should have been about 8, that tends to give us a little bit of it is a bit of a red flag on something about probably certain martial arts, which will cause people to have more hip issues, especially at a younger age. This report was looking at people younger than 50, and actually went as low as the teens. And the only sport that actually had teens with hip issues were martial arts. That's actually a big that's a big flag that goes on. And so we do have these numbers, and we can look at what the normal population should be. Now, a couple things that are going to be, or a couple things that actually are issues with this is, I'm actually talking about numbers and using the normal population of the U.S. I don't know where this report was originally studied, where the sample size. It was a relatively small sample. It was only 156, but that's pretty much in a 10-year period of collecting data. That's how much that hospital was able to find of these. So it may be low, but it's actually expected with the numbers. So these could be sampling errors. But when we start seeing something like this, it may be it's too big to just dismiss. And there's more that we're actually going to go through. So we're seeing a lot more from martial arts. Now, they actually did something else. The article that looked at the incidents also looked at cases where they were specific. This could say for sure that these were caused by that sport. And they didn't find one for baseball. There was one area that it looked like they were saying 23, but it doesn't necessarily look like it after I continued reading it. But what they found is 28 of the injuries of the hip, which were found in soccer players, were definitely caused in soccer. That's actually a lot about what you would expect from injuries just from the population of soccer, of the amount of people that normally play soccer. By the way, if you're in Latin America, it's probably going to be a lot higher than 30%. If you go to martial arts, the numbers that were definitely caused by the martial art was about 29 cases. This is still about 6 times more than what you would expect just because of the fact that people were going to get injured doing any physical activity. And so, well, if you are in baseball, you may want to try to figure out what's happening in baseball. As most of the stuff I do is in martial arts, that's a number where we're looking at. Why could this increase in incidence of hip injuries happen in martial arts more than in other sports? And I tend to look at normal range of motions. For instance, if you actually look at front kicks, raising the leg up has a relatively good range of motion. There are going to be some cases where if you go too high, it will be too much. But for the most part, there's a normal range of motion where you can do front kicks pretty high. If you start going to the side, a movement called abduction, the hip only has about a 45-degree abduction. To think about this, if you think of the floor, and you're standing here pretty much perpendicular to the floor, if your leg goes up parallel, you're at 90 degrees. So you're actually twice the normal range of motion for the hip. if you're standing parallel to the floor, you should only be able to go 45 degrees before you start causing shifts, before you start interfering with normal range of motion. You're actually going beyond as you go up. Now, usually what ends up happening is you tend to lean to away from the kick to get your leg higher. So you end up, yes, you can end up getting really high kicks. But again, if you're going to beyond 90 degrees, that would actually be both you pretty much parallel, one leg coming straight here and one leg coming straight out to the side. That would actually be the maximum range of motion. So if you're going beyond that, pretty much if you're going beyond 45 degrees, you are either going to affect one of the hips. If you go beyond 90 degrees, you're going to start impinging areas of the hip. And that's just normal range of, that's actually just dealing with how the body moves. So we do have these normal range of motions, which can actually cause, I talked about correlation between the fibular acetabular impingement and the artery, did find that abnormal ranges of motion could compress the artery, and it looks like the areas where you had compression of arteries did end up leading to other issues. And so when we put this all together, we can see a bigger picture. But here's an important thing. Without questions of, well, why? Are there any more numbers? Are there any other reasons why we're actually thinking this? Without looking at questions, we really can't expand our knowledge. We can't really look at what reality is. That's actually one of the things with science that people forget. Science is always changing based on new information. As we get new information, what we believe at one point isn't what we believe now. That's why a lot of times people get really frustrated with scientific communities and medical communities tell you. They may say, this is what we believe. This is how you stay safe. And people will say, well, that's not what you said last week. And that's the thing is, well, last week we didn't have the information, we have it today. And so that's actually a big thing with science is, yes, it should always be changing based on new information. And if information isn't there, or if new information is collected and it is different than what we were expecting, we have to change our way of thought. Now, I hope this makes sense. I hope this is something you enjoy. And I hope if you have any questions, you'll write them on the comment page. I will put links to the 2 articles I mentioned in the description. And I hope you have a nice day. This is Rafael Gutierrez, Karate Doctor. I actually do have an MD, by the way. And so I guess I'm signing off and hope for the best.